Good evening, viewers. Welcome to a brand new episode of BMC Global Life, AL-HILAL Health World, nothing but the lifestyle. This is a talk show aimed at providing useful information and tips on various health-related queries and concern. I am Anupama Menon. We have here with us today Dr. Abuzer Surka, who's a consultant pediatrician and the head of the pediatrics department of AL-HILAL. He comes with a wealth of experience in pediatrics, having served for almost 27 years, 10 years in the Middle East and 17 years in India. In addition to that, he's an expert on the field of allergies with experience of over 25 years in treating various kinds of allergies, food, cough and skin allergies. Welcome to the show, doctor. We are delighted to have you here with us today.
My pleasure to be here.
As you all know, winter is on its way out and summer is round the corner. And we all know how harsh summers can be in the Middle East. So today's topic of discussion is summer illnesses in children. So doc, could you please throw light on some of the summer illnesses that kids could develop during the summertime?
Yes, of course. Actually, as we know, the children are very, so sensitive to the climatic changes. And when it comes to summer is particularly harsh for the young kids. So most common illnesses we see is which are food and water related. Another group is the skin disorders. Regarding food and water, we commonly see vomiting, diarrhea, and the kind of illnesses which can upset the stomach of the young child. Secondly, the skin diseases are fairly common, which can be connected to the harsh sun rays, which can also include sometimes sunstroke. There may be certain skin allergies which are particularly common in summer, and also there can be dehydration and high grade fever disorders, which are also very commonly seen in young children in the summers.
Okay, so you spoke about dehydration now. It's very difficult because sometimes kids go out to play, they get engrossed in their activities, they don't even remember to drink water. So anything that the parents can do to make sure that the child is well hydrated?
Yeah, of course. The parents should keep note of how much is the fluid intake of the child, particularly if they are playing outdoors. The fluid intake should be at least 2.5 liters per day in any form of liquid like plain water, juices, or even soups, which also contain a rich amount of the several vitamins. Secondly, they should keep their eyes open for the signs of dehydration in their kids. The common signs will be that a child may sweat a lot, which can lead to even salt loss along with the loss of water. So the child may feel very tired, may sometimes feel giddy. The child may have very less strength. So to maintain this adequate level of salts in the body, the oral rehydrating salts, which we often call as it is known popularly as ORS, they should be given frequently to the children. Also, there are certain these glucose drinks which also contain vitamin C, which should be regularly given to the children if they are playing outdoor sports, particularly like football, cricket, or any such outdoor sports during the summer. As far as young children are concerned, the parents can also keep a tab on the urine output. So if the urine output becomes less, then they should think of dehydration as the first cause and try to maintain the adequate fluid balance in the children in the form of giving adequate amount of liquids. If the baby is less than 1 year of age, the most common thing is the milk or the feeding which the mother is giving to the child, because as we know that in Bahrain the summer also brings along with that lot of humidity, and because of the humidity there is a very high risk of dehydration because we sweat a lot. And so we have to keep in mind, although we always stay in the air cons in the house and everywhere, even then the children can get exposed, can get dehydration. So we should, the parents should particularly keep in mind two things: to watch for the signs of dehydration and to keep their child as much as rehydrated as possible.
And during summertime, because of the intense heat, kids have a tendency to go for all that wrong kind of foods like
Yes.
ice creams, cold water, juices. So what would you suggest? What is an ideal diet during summertime to make sure that their body temperature?
See, I would like to correct it. It's not the wrong kind of food. We also like ice creams.
That's
so
true,
ice
very
creams,
true.
we should not deprive our children of ice creams.
Yeah.
The thing is that try to give something of a very good standard, good quality to the child. Secondly, the juices is a very common thing, and I always advise my patients to their parents should give as much as possible fresh juices made at home. Don't try to give packaged foods. Why? Because packaged drinks contain a lot of sugar, and the sugar will further sometimes aggravate the dehydration because it contains no vitamins and salts, very less amount. So as far as possible, try to give the fresh juices. It is okay. It is healthy.
Okay.
Other food is that avoid the oily food, fried food as much as possible. It will be too harsh on the body. Try to give the fruits and vegetables more in amount as they contains as these fruits vegetables also contain a lot of water in them, along with their fiber and vitamins, essential vitamins for the body. So the parents should make it a point to give more amount of fruits, vegetables. You can give the grilled items, avoid the oily, fried and spicy items because that can cause sometimes gastric trouble also, which is more common in the summer months. So these things should be kept in mind. And also ice creams, let them eat and enjoy the ice cream. That is the only season they can.
I think kids will be very happy to know that, and parents too, if they can give ice creams to their children,
Only
nothing
just keep
better
in
than
mind
that.
they don't have allergies.
In moderation.
Moderation.
Yeah. And, a lot of kids face this problem of allergies. So, is it seasonal? Are there special allergies which crop up during summertime, or it's.
Yes. The allergies are allergies are always vary according to the season of the year. Like for in winter, we see more of cough and cold allergies. Similarly, when we are talking about summer months, the more common are the skin allergies. And secondly, is the food allergies. Like food allergies means there will be a lot of food infections, foodborne infections, and those children which have got allergies, they are more prone to get this sort of infections. Skin allergies mainly because of the sweating and this high level of humidity. The skin is also exposed to the fungal infections because of sweating. So take care to keep the skin folds. Skin folds means the area of the skin near the neck, near the groin, near the axilla, and the arm folds. These all areas they will be more sweating. It will be more damp and wet and humid. So try to keep it as dry as possible, especially in the younger kids. They don't understand it. They will not take care themselves. So the parents have to be sure that the areas are dry and they don't get infected, and also skin rashes, allergies. Another important aspect that we keep in mind in Bahrain, especially that kids, parents and also families like to go swimming a lot during the summer months. When you go for swimming, the skin allergies are far more. There is a high risk of the skin allergies. So try to keep that in mind. And after going for swim, just ensure your child has a thorough bath with fresh water, so that all the chemicals or whatever salt which is remaining in the body, it will get washed away. So this thing should be kept in mind during the summer months, and take proper care of the skin.
Okay. So, any special skincare tips? Because the summer being very harsh here, there are high chances of getting them sunburnt. Like you mentioned about swimming, sometimes we don't even realize, only after you come back home you realize that your skin has been burnt. So, any special skincare tips? Like, are they allowed to use a sunscreen and?
See, sunscreens is a very much debatable topic because it has got a benefits as well as the risks. So I would like to prefer that more importantly, to avoid the sunburns, keep a loose light clothing for the child all over the body. When you go swimming, as I told you, after the swim or the bath, just thoroughly wash your child, or let him or her take a proper bath with fresh water, so that all the chemicals or salt are washed away, so that the skin will not get harmed. But using sunscreens and chemicals is a purely debatable thing, and I would not like to go into that because some people advocate, some people have got also side effects with that. So it's purely a personal choice. Although we have in the market all different types of sunscreens which are also available for children also, but even then they all contain the chemicals which have proven to be sometimes harsh for the children. So
So we have to be cautious.
instead of going for that, first of all let us take proper care of the skin. Let us keep the skin clean, hygienic, and keep the skin covered during the particular afternoon times. Although most of the times kids are inside the house only during the afternoon, they don't go out in the harsh sun. Sometimes on the weekend we go to the beach or we go anywhere outside. So let the kids be covered, whole body covered, but with light cotton clothes and not very heavy clothes, and so that the skin will also be safe, and there is less risk of skin burns.
Okay. But as you said, physical activity is very important for the kids. It's so difficult to keep them confined to the homes, even if it's summer. So, what kind of sports activities can they indulge in during the summertime, which will not create a very harmful impact on their health or their?
Yes, see, always physical activity is important for all ages, as we know. So it is also very much true for the children, and especially last 2 years we all were inside the house, and now we are all raring to go out and
Very true.
and enjoy
Yes.
our life fully.
Yes,
So
absolutely.
this coming summer, Don't confine your children to the house. Let them go out, play. But what sort of sports, as you asked? So they can, according to the age, yeah, like children more than 5 years of age, they can play, football, cricket, go swimming, but with all precautions. As I said, when they are playing this, sort of vigorous sports like football or cricket, they need to be properly hydrated. So give them enough stock of the rehydrating solutions and fresh juices, water, and keep them hydrated. That is the first and foremost thing. Regarding the skin, let them play, but after they are done with their sport, they should have a proper bath with fresh water. That is very important. They should also go swimming. Swimming is a very good sport during the summer times, and especially in the summer only we get a chance to have a good swim. So let them burn their calories and let them enjoy the swimming also with all the precautions as I told you previously. For the younger children, they are mostly confined to the house, but play light sports like they go to the park, they can enjoy certain rides, and they can get exposed to the sun also, because as we all know, sun is also a very good source of vitamin D, and vitamin D is very important for the growth and development of children.
For the bones and all that.
Bones, the any vitamin D is it takes a part in the metabolism of so many things, even for the hair growth and even for the bone.
And I think that's one thing we're deprived of in the Middle East because
Very much,
because of
because
the
we
heat,
always
we're mostly
choose to
confined to
stay
the house.
indoors. Yeah, and even in the winter, but last 2 years we were almost we were afraid to go out during this time. So like, let us go out and play, but with all the precautions, standard precautions. Also follow the health protocols as has been. I'm sort of advised by the ministry to keep ourselves safe also from COVID. But along with that, also we should enjoy the nature, enjoy the sunlight, take the precautions, and don't get dehydrated. See, there is one only thing, bottom line: take care of your skin. Don't get dehydrated. Ensure you and your children are having enough amount of liquids and fluids per day. So keep yourself hydrated, and just avoid too much harsh conditions on yourself. And it's all up to us. And whenever the child feels tired, they cannot do, then don't push. Let take a rest. Again, you can take the child out. And actually, 1 to 2 hours of physical activity per day is more than enough for a child.
I think parents also observe their children and find out, if there are any red
Yeah.
flags, if they're
Of
getting
course,
too
and all
tired.
children are
And
not the same.
exactly, every
Sometimes
child
some
is
have
different.
some
Yeah.
problems, some have some allergies. So looking into all that, but as a generalized rule, let them go out and enjoy the fresh air, enjoy the sunlight, enjoy the sunshine, and then take the call.
Now, kids will be going back to school now that the COVID situation is improving. I think next year onwards it will be regular school. So, what precautionary measures can the parents and the children, both of them, take to make sure that they are healthy and
So this is a very nice question, because it is a sort of obligation on us to follow the health protocols which have been laid down by the Ministry of Health. So we should also follow this for the children. Get our children vaccinated above 5 years of age, as and when we get the guidelines for vaccination. That is the first protocol we should follow before sending the children to school. Give them the adequate protection for COVID. Get them vaccinated. Then secondly, follow the protocols of social distancing, masking. That is always there. Along with that, the children should be taught the rules of hygiene, hand wash, and also cover their faces, because children are very small. We know we cover our faces when we cough and cold or cough and sneeze, but the children, they may not be aware. So we have to teach them, we have to make them aware that they should not pass any sort of even mild viral infection, not COVID only. Sometimes we have flu, sometimes we have any other viral cough and cold. They should not pass that infection to others. So that these basic rules of hygiene, which they may have, because they are not going out for last 2 years. So again, we have to keep that in mind. Secondly, after vaccination, give them proper healthy food to help to increase their immunity against the common infections, like this adequate supply of fruits, vegetables, vitamins. This helps to keep the child well protected against other infections.
and any advice that you would like to give the mothers of newborn children, because that's a stage when all the mothers are extremely careful about and worried about how to handle the child since the child is very small. So any
So
special
newborn, regarding the summer, you mean?
yeah, during summertime, how often can they be taken out, how much they can be exposed to sunlight? And
See, that again the basic rule is the same for newborns. Avoid the dehydration, avoid the harsh sunlight. They can take them out in the early morning or late evenings. It is a better time to take them out. Keep them protected by proper adequate covering. And newborns, usually after 6 months of age, they have some level of immunity. So you can take them out and let them enjoy the surroundings, because That is also an important part of development of the child also, to get mixed with the surroundings, to see and acquire new things, to see and look at new things. If you keep them confined in the house all the time, it also affects their development, like psychological development, social development. It is very important. So you can take them out, but usually we they take after 6 months of age. You can take the child, the small baby out very much more freely.
You spoke about development. So, any particular activities that the parents can indulge in with the newborns, like maybe from till the age of 1 year, anything that will kind of help them to develop their mental faculties and their physical health?
Yes, we can. See, the first year of age is very important for the psychosocial development, the fine motor development. This development is of different categories: fine motor, gross motor, psychosocial. Gross motor mainly the walking and running. It comes after 1 year of age. First year the child has to get proper sort of stimulation for the development of hearing, development of speech, and development of vision. So for that there are age specific toys you can get in various child care. I mean we have got shops which sell child care products. So according to the age you can give, like for 4 to 6 months of age, bring the toys with particular sounds and sort of specific colors. Child knows how to follow the colors, follow the sounds. Then you can even put audio visual stimulations. Nowadays we have got there's so many videos are there for children that the child will be able to see after 6 months of age, make some eye contact, and also get some sort of stimulation for this development of the mind, development to sort of recognize certain voices, certain sounds, and also to follow certain objects. More importantly, after 4 months of age, the child also looks in the mirror and smiles at his own self. So you can put something like that in front of the child, a mirror. You can even child will be able to recognize the caretaker like the mother or the father after 6 7 months of age. So you can interact with the child and try to just make some sounds. Child will make some sounds to
So, the
just
child can mimic
sort
those
of
sounds.
steal your attention. He wants your attention. Try to make some sounds, babbling, and you can also even sort of babble or speak with your child, with a baby. So child gets that stimulation to just hear those words and then formulate at a sort of later stage, like 10 months, 11 months of age. Child will start making single words, or like we call it monosyllables. So this way you can help the development of the child. So the most important is social interaction. You continue to interact with the child at different stages. Don't just leave the child and you go on doing your work and you just play with the child when you want to. The child also yearns to be with the caretaker. So try to interact more. Especially after 5 6 months of age, because that is the age the child begins to mingle socially with the surroundings, with the siblings, with the caretaker. So I would advise that maybe we have a nanny in the house, but the parents also need to interact with the child. Such a child will be more easily be able to recognize the mother or the father and have that bonding with the mother.
That's good to know. Anyway, Doctor, before we wrap up this episode, any final message you would like to give our viewers regarding the general measures that needs to be taken during summer?
Yeah, summer is we need to we should keep in mind that we should enjoy each and every season that God has given us. So don't be afraid of summer. Let's just take the adequate precautions, as I told you again before. I would like to just speak in a sort of nutshell. Keep yourself hydrated, keep your children hydrated, avoid skin allergies, particularly take care of the skin, and also take the child out for some physical activities, and just take in the best of the summer and avoid the worst.
Thank you so much, Doctor. That was a wonderful insight into the summer illnesses, and I'm sure your words have put a lot of parents at ease, and even the kids also. So, as Doctor rightly pointed out, enjoy the summers. Occasional ice cream is always allowed. Do everything in moderation.
That has always been a motto. Enjoy life.
Enjoy life.
And we just keep it in moderation. Take the precautions, and at the end of we are always there for you if you need us.
Exactly, and that's a big relief for us. So stay hydrated, take care of your skin, have a healthy, balanced diet, as Doctor rightly pointed out. So let's welcome summer with happy, smiling faces, and let's enjoy it. So stay tuned to BMC Global Live for more informative episodes like this. This is Anupama signing off till we meet again. Goodbye, stay healthy and stay safe.